Is our coronavirus briefing for Thursday, April the 16th, 2020. In the state of Texas, as of yesterday, we have over 15,000 confirmed cases, 36 deaths in the state. 364 deaths in the state, 36 confirmed cases in Midland, and 2 deaths in Midland County. The hospital census today, 129. We saw a slight uptick yesterday in emergency department volume at 90 patients. In our critical care unit, we have 14 persons under investigation for COVID-19 infection. There are 6 in the critical care environment and 7 in other locations, a total of 13, with 7 of those now confirmed positive for COVID-19. We have 5 patients on ventilators out of our complement of 44 total ventilators. A little bit of news here today. I've talked a couple of times before about the advance payment coming from the Medicare program. That was received this morning. They've paid us 6 months worth of average Medicare reimbursement in advance. That's effectively a cash flow loan that will be interest-free for 4 months and then paid back very rapidly after that with recoupment from payments that we would be getting in month 5 and beyond. But it is a help to get us through this difficult period where revenues are down, collections are down, payrolls and supply costs still have to be paid. So we appreciate the advance payment from the Medicare program. Also a small advance coming to the physician practices that we manage, which will be helpful to them as well. We have begun talking yesterday in earnest with our surgeons and anesthesia providers about what happens if and when the governor lifts the moratorium on elective procedures, or at least relaxes it. We think that that could be coming as soon as today. You may remember that the governor's original moratorium on elective procedures ran through April 21st, which is this coming Tuesday. So we've begun that conversation about how we can prudently go back to work, recognizing really important concerns with regard to the continuing availability of personal protective equipment and the need to carefully manage our available beds in anticipation of the remaining possibility that we could have a spike in COVID patients. So we're going to be very thoughtful about that. Our preliminary discussions included a small team of folks who would assess the schedule each day and determine what we can reasonably do in light of the available personal protective equipment and bed availability, and adjust on the fly. So there'll be more to come in the next day or two, we hope, as the governor makes a decision about what happens on the 21st. But we are actively discussing how to go back to work. Just exactly when we'll do that remains to be seen. A couple of important reminders I'd like to share. One is with regard to the emergency department. I've been reporting every day that emergency volumes are down. There is some anecdotal information coming back to us from our emergency providers that some of the patients who have other diseases, may have chest pain, may have signs and symptoms of a stroke, may have abdominal concerns, may have had an injury. Patients are tending to wait longer to come to the ED than they do in normal conditions. And while we appreciate people maintaining our ability to care for the COVID-19 patients, we are still here for patients with other diseases and injuries and concerns that need immediate treatment. If you have chest pain, don't wait. Call an ambulance, come to the ED. If you have an injury, if you have signs and symptoms of a stroke, don't hesitate to come to the emergency department. It is safe. If you're not sick, don't come. But if you have a serious illness or injury, please do come and don't wait and allow your injury or illness to get worse. On a somewhat similar note, I want to remind people and encourage them to use our 6-8 Nurse hotline. From the very beginning, part of our protocol has been if you feel sick, if you have respiratory symptoms and fever and other signs that could be indicative of a COVID-19 infection, the first step for you is to either call your doctor if you have a relationship with a primary care provider, or call 6-8 Nurse 24 hours a day, 7 days a week. Our nursing staff are on duty and ready to answer your questions, to walk you through the protocol, and if you meet criteria, to refer you for testing in our testing center. So please don't hesitate to use the 6-8 Nurse call line. Finally, my last remarks are a word of thanks today to our perioperative staff. That's the folks who work in the operating room and the recovery room and the pre-op areas. Those folks have not had much work to do in their normal environment over the last few weeks, but they've been real troopers in redeploying to places like the surgery waiting room, where we have a team of sewers making masks every day. We have people at our entrances implementing and managing the screening process every day for potential visitors and patients as they come into the hospital. We have people helping to man the 6-8 nurse call line. All of these are duties that are beyond their normal scope. They've stepped up and provided these services with good spirits and without hesitation. So a great deal of thanks to those versatile folks who work in our perioperative areas. Thank you all very much. Let's see, I'll stop and take a question if anyone has one for me, and then I'll call on Dr. Wilson.
Tassa has one question for Facebook, so go ahead, Tassa.
Yes, how many or has there been people suspected of contracting COVID at the hospital? And would you consider that a good idea to resume even if the governor lifted the ban?
So the question is how many, I presume that means how many staff members have contracted COVID? That
would be my
is that
assumption.
the way
Yes.
you take that question? As of now, I don't think we have had a positive staff member. I think you'll remember early on, our very first patient, as we were getting our procedures well oiled, there were several days when that patient was not recognized as a person under investigation. So we had 30 staff who were exposed to that patient. Those staff members were carefully monitored by our employee health group. And at this point, I believe all of them have moved through the 14-day process and have been cleared with no positive test results. The second part of the question was about the relative wisdom of returning to work. I mean, that's the way I took it. And I think that is a challenging issue for us without question. I expect that the governor's pronouncement, whenever he makes it, will at least be some loosening of standards and allowing hospitals to consider going back to work on some level. We have to be very careful about that, recognizing that personal protective equipment remains dicey. Some elements are easier to get than others. We have a substantial supply of just about everything we need, but we have to continue to be very careful about how we use it. So that's a legitimate concern. We also need to preserve available beds in the hospital, especially in those units we've set aside for COVID patients. And we have a plan for how we think we can do that. But as we go back to work, we will carefully manage. Every day, every other day, we'll have a team that looks at that schedule and judges whether the cases that the surgeons want to do or need to do can fit within our available PPE and our available bed supply. As always, the majority of the cases we do will be outpatient. That's the way our system works. Most hospitals see that. For us, it's 65–70% of all the work that's done on an outpatient basis. So that doesn't really stress the inpatient environment. But we do have to be thoughtful about personal protective equipment. And we will be, not only as we start back to work, but on an ongoing basis, every day, every week. One more point to make about that, and this was raised by our surgeons, we've heard it all along. Elective surgery doesn't mean cosmetic procedures, things that are not necessary. What it means is care that can wait. The patients still need the care. We talked about a variety of examples last night. One that's very familiar to me, I've had both of my hips replaced. If I were lined up to have a total hip replacement, I could wait. But while I would have been waiting, I would have been in pain. I would have been limited in my mobility. My ability to exercise and take care of myself would have been limited. So these are not cases that are unnecessary. They're cases that are elective. That means they can be deferred, and we will defer them if we need to. But this is care that needs to be delivered. And so we're doing our best to balance the needs of the whole community against the severe concerns that we have over the COVID-19 pandemic. Other questions?
Yes, sir. We have some more from Facebook. Do you expect to start doing randomized testing to find out the amount of penetration the disease has had in our community?
The question of randomized testing, which I presume means antibody testing in light of what's been discussed most often in the media lately. That's not available to us today. There may come a day, hopefully soon, when we can do that. But we just simply don't have the testing capacity or capability today in this community. So no, I don't expect to do that anytime soon. I think we would all love to know the extent of the disease in the community, especially those folks who have had it and recovered and are relatively immune. But we are not in a position to know that here in the near term. One day we hope we will be.
A follow-up question to that is, will we ever have access to this test, or do you have any kind of forethought or information of it coming to our community?
The availability of testing is one of many elements of the supply chain challenge that we're all facing. Testing is going primarily to the areas that are the hardest hit. The manufacturers of testing and reagents don't have the capacity to meet all of the demand for a nation of 330 million people. And so our limited production capacity tends to be going to the places that need it the most. We're really blessed in Midland. We have not had a huge outbreak. We haven't had a big spike. Our hospital facility hasn't been overrun with patients. And that tends to put us lower down the list of priorities for those manufacturers and distributors that provide us with personal protective equipment, with testing, even with other goods that are unrelated to the COVID-19 pandemic management. So, it's a mixed blessing. We don't really know. We talk every day about the supply chain, and it changes every day. We have no way of knowing when the antibody testing, when our PCR testing for our in-house lab equipment will become available, so we can test patients in real time in large numbers. We just don't have good information, and it changes every day. Okay, there are no more questions for me. I'm going to call on Dr. Larry Wilson to make a few remarks. Sorry.
Thank you, Russell. Dr. Larry Wilson, Chief Medical Officer at Midland Health. I want to echo something that Russell commented about with the 6-8 nurse line for calling in. It is the access for anybody in the community that has concern about the virus to call and schedule an appointment to go through the drive-through testing center. It's also, and as Russell alluded to, you can call there for questions about any other health issues as well. But that's the line for patients to call to get access to an appointment to go through the drive-through. The drive-through does not accept people just driving up. It's really appointed visits only. And any symptoms now, the circumstances have been liberalized. So we had been asking patients about fever and constitutional symptoms that are consistent with a respiratory tract illness, and that no longer is required. It's really any symptoms whatsoever. So if you have symptoms and you're concerned about the COVID infection, you're welcome to call 6-8 nurse and schedule an appointment. There are over 50 appointments available on a daily basis. And as of yesterday, he's had empty slots available every day. So to the comment of the question that was asked earlier about testing, Russell appropriately answered about the antibody testing, which would show immunity. But there is, as we have spoken about here before, penetration of the infection in the community in asymptomatic people, both pre-symptomatic, and they're going to get sick, but they haven't, and those that never get sick and carry the virus and can shed it. So the more testing we do, the more information we have, and the better we can do to manage the disease. I wanted to touch on one other subject, that this has been something I've been seeing a lot in the news nationally, statewide, and certainly in our own community as well, is the importance of liberalizing how we're behaving and getting back the economy on track. I think we all recognize the importance of doing that, but I think it's very, very important that we remember this is not some kind of a validation that we have the virus under control. We still have a viral pandemic going on, and it remains a serious threat to all of our citizens, particularly the aged and the vulnerable. But we have to acknowledge also we have an economic pandemic taking place as well, and this is a pretty dangerous circumstance in and of itself. And people above my pay grade and in different lines of work are trying to solve that problem. And I'm just here to remind us that as that problem is solved, we still have a very significant virus. We have a virus that's very transmissible from one individual to another. a virus that can be in one person and not produce any symptoms, but be transmitted to somebody else that does get sick. And in many of those people that get sick, they'll get sick enough that they require oxygen or hospitalization, and a small subset of that population dies. And this is really our responsibility as we do get back to business and get back to work, that we do it in a way that we remember those things and do everything in our power to protect the vulnerable and the aged, get things going in other ways, in every way we can, but be cautious, careful, protective of all our citizens. As we get more testing, we'll have more information, get to the point that we have immunity from either herd immunity because enough people have been infected, or we develop the vaccine. Things can get back to some level of normalcy, but I don't think we'll ever have a completely normal, at least in our lifetime. We'll remember this, I think. And as long as it's still going on as it is today, social distancing, hand hygiene, cleaning surfaces repetitively when you're working in an environment, if you do get back to work, all of those things are very, very important. So congregating in groups is going to remain a very, very risky behavior until we get this under control. So I appreciate everybody paying attention to that as we get things going, as the governor, the mayor, and others make the decisions to move forward. So thank you. I'll entertain any questions.
All right, Dr. Wilson. The first one we have is from News West 9. Sammy said, I'm told MMH is working on plasma donations from recovered COVID-19 patients. Can you explain why this is important?
Certainly. So our pathology department, led by Dr. Klingensmith, has been very active in this area. And the importance is, if we recognize somebody has had the SARS-CoV-2 infection and they recover, the reason they recover is because their body has developed an immunity to the infection. For over 100 years, we've recognized that within our blood stream, there is plasma. It's the fluid that carries the red blood cells, the white blood cells, et cetera. And in that plasma, there are antibodies. There's blood clotting factors and other products as well. But at the end of the day, what we're looking for is the antibodies to the virus. And in those that have recovered, and there's specific guidelines on how you look at this, they have to be 2 weeks out from the infection. They had a positive COVID test on the front side, a negative COVID test on the back side. They can donate plasma. And I'm sure you've seen or heard of plasma donation centers. And this is the volume of fluid that is used for coagulation factors. It's used for volume expansion. It's used for a variety of different things. But in this particular role, we're asking it to be used as a therapy because of the antibody. So you're basically using it as an antibody donation. And those antibodies then can be given to another individual and provide passive immunity, meaning they didn't develop the immunity themselves, but it'll wipe out the virus because they have the antibodies to do so. And it's been used around the world in a very limited way. We did a literature search on it, and there's probably been, with this particular virus, less than 50 applications that we were able to find in the literature. I'm sure that's expanding now, particularly in the United States, but that's a pretty small number to know the safety profile. I mentioned that plasma in general is very, very safe to be given. We give it for a variety of other reasons, but whether having passive immunity may shut down your immune system's response and you may not develop active immunity for yourself going forward, for instance. There could be other risks as well. And unfortunately also, there's not a whole lot of people that are aware of this, and there's not a whole lot of people that have recovered from the COVID infection. Remember, this has only been going on in this country for a few months. So, getting the plasma or the serum for everybody that would like it will be a challenge, like every other thing that Russell and others have mentioned about the supply chain. It's going to be a limited product, but when it's available, it will be used in the circumstances that are appropriate, and the FDA has those delineated.
And the next question is from Stuart at the MRT. He asks, how much of a worry is the confirmed test from a second nursing home?
Well, we've spoken about that a number of times over the last couple of weeks here, that our primary concern isn't those asymptomatic carriers and those that have minor illness and stay home in quarantine, but it's the aged and the vulnerable. And long-term care facilities have aged and vulnerable people by definition. So anytime it gets into that kind of an environment, it's of concern. We speak to them on a daily basis, the health department, Midland Health, and the long-term care facilities are working together to try to minimize and mitigate the exposure of others in those circumstances. They're using all the appropriate PPE, and they're keeping isolated patients that are infected. Fortunately, the one that was mentioned by Stuart, that patient has been asymptomatic. He was screened going in because of the concern that everyone has, and the screen came back positive. It was a surprise, but he has been isolated. He's been quarantined, and we hope that that will contain the disease in that particular environment.
And now Tasa has a Facebook question.
I have a few questions. I'll start with someone asking about symptomatic versus asymptomatic and the testing that we've done around 900, or we've tested around 900 people. Does that mean that all that have been tested had fever or presented symptoms?
Early in the program, remember, this has been a rapidly evolving circumstance over the last few months, and there are specific guidelines provided by the CDC and others on how to go about managing as we got started. And early on, the guidelines were symptomatic patients with respiratory tract illness symptoms and fever were the ones that were at risk and concern, and those were the ones that were being tested most regularly. As this has evolved in the United States, and there's been many, many cases and a lot of information, observational data coming out of New York and Kings County and Seattle, Washington area, and California and other places, showing the information that we've talked about here now, that the people that are asymptomatic can be carrying the virus and can be shedding the virus and exposing others to it. So in the last week or so, or maybe a little bit more than that now, the criteria for testing have been greatly liberalized. We remain with the supply chain issue. We don't have all the testing we would like to have for everybody we'd like to have it for. If we did, I'd be in favor of screening everyone so we can find out just how much asymptomatic disease there is and how many people are developing antibodies and getting better. But we don't have the capacity for doing that. So we're limiting the testing to those that feel of concern and that need to be quarantined, and obviously those that are being hospitalized or developing symptoms in environments where others would be put at risk.
We have another question. Have you seen an increase in mental health cases in Midland?
Okay, I'm looking at our Chief Nursing Officer. I had not heard of anything along those lines. Kit, do you want to address that question? Sure.
So as of today, the number of mental health cases that we get out of the emergency department is remaining relatively flat. We actually had a fairly decent amount prior to COVID, and so we're still seeing around that same pace of folks that are getting consultations. We are doing more resources in the community as far as mental health resources with online different consults that we can do, and also the different groups like Texas Tech Psychiatry. They're offering some to our employees, and they've done more outreach as well in the telehealth realm. So hope that answers that question.
Is that all the ones from Facebook?
Sorry, Erin, I have one more, and I think it's
Okay.
for Dr. Wilson. And I apologize, I will probably not pronounce this correctly, but does Midland Memorial have remdesivir as an option for treatment?
Sure. So we have a meeting on a daily basis with a multidisciplinary team that Dr. Bredemis, myself, and pharmacy and many, many other people attend to look at what resources we have, what treatments we have, what testing capabilities we have, and review just this kind of a topic. So the remdesivir is one of the antivirals that has been looked at with mixed results. I think it's probably very similar to what we've said with hydroxychloroquine and other therapies. Unfortunately, on the one or two occasions where we have requested it, it has not been available to us. Again, a supply chain issue that's been going on. There are one or two other drugs that are in similar classes that we have tried in circumstances. And so we're looking at every avenue and every pharmaceutical and other therapeutic opportunities. Unfortunately, there's limited information on pretty much all of those, and the information we have is generally mixed in terms of the effectiveness. Okay, thank you.
Dr. Wilson, we have one more for you. Mitch from Marfa Public Radio asks, Since the 90-year-old man at Manor Park acquired the coronavirus through community spread, should we expect more residents testing positive for COVID-19 at Manor Park in the coming days?
It's a good question. I'm happy to say that this individual had been living independently, had an injury that required him go into the care facility, and because of that was screened, tested, and placed into the facility. And over the last several weeks, Manor Park and all the long-term care facilities have done a remarkably good job in making sure all of their patients are kept away from one another. So they're all dining in their rooms, they're separated from one another. Anybody accessing the rooms washes in, washes out. They've been very, very careful about exposure of one to another. So I think there's a pretty high likelihood or opportunity that this was not spread amongst any of the other inpatients there or the residents there or among other workers there. There's always a risk, but I think they've done a pretty good job of protecting everybody.
Thank you, Dr. Wilson.
You're welcome.
At this time, we will now turn it over to Whitney Craig with the City of Midland Health Department.
Good morning. I will start off by giving a breakdown of our total cases and a short statement on the nursing home case, and then I will allow for questions. Our total confirmed cases are 37. For source of exposure, we have 13 that are travel related, 18 that are contact to a known case, 6 that are from community transmission, and 0 that are currently still under investigation for that. As far as gender, there are 16 that are male, 21 that are female. For ages, we have 2 in the 0 to 19 bracket, 14 in 20 to 29, 6 in 30 to 39, 4 in 40 to 49, 4 in 50 to 59, 2, 60 to 69, 2, 70 to 79. And for those over 80, we have 3 cases. As far as the patient status, there are 4 in the hospital, 1 in a nursing or rehab facility, 7 that are at home isolation, 5 that have completed isolation, 18 that are considered recovered, and 2 deaths. For medical visit, we have 16 that were tested at the drive-through, 8 at their private provider or clinic, 6 in the emergency room, and 7 as inpatients at the hospital. As far as investigation status, 17 are still ongoing and 20 are marked as complete. So our first release yesterday dealt with Midland Medical Lodge and their first positive case. About the day before yesterday, all the days are known together. Up until the release, there was low concern for spread among the residents due to the mitigation efforts and infection control guidelines that were in place. And Dr. Wilson did speak to that also. Once we were made aware of the positive residents, we made the announcement to remain transparent and inform the public. As mentioned, the facility has not allowed visitors, which also reduces the impact on the community. Speaking to Manor Park as well as Midland Medical Lodge, they have been in constant contact with the Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, as well as following the Texas Health and Human Services Commission's guidelines. They have been great with mitigation as well as making sure they're masked and gloved, creating designated isolation areas for patients, testing symptomatic residents, and checking for symptoms of the residents as well as staff. We were made aware that once the governor made his declaration, there had been no visitors, and some of the nursing facilities have also made it so that there are no new admissions. So that would also reduce the risk of bringing any additional exposure to the residents. Okay. Any questions?
I'll give them 1 second to see if anyone has any questions to type out. Okay, we have one question from Sammy Steele. Sammy, you can ask it.
There, you guys. Happy Thursday. Okay, I have a question. We're seeing this on Facebook, and we're just trying to either nip it in the bud or verify it. That 3 people who were have tested positive for COVID-19, that they were all at Woody's. And one of those folks was a security guard at that bar. Have you guys put together, has your investigation led to Woody's being a potential place for an outbreak where these 3 people might have gotten it?
Yeah, no. I'm sorry to say, Sammy, but that would be misinformation from our standpoint. We don't have any of our cases that are employed at Woody's. So to answer
Okay,
your question,
perfect.
then it would be, our investigations wouldn't have led us to that location.
Okay, well, thank you.
You're welcome.
And the next question comes from CBS 7, kind of reiterating what you talked about already. They want to know why the information wasn't released on April 3rd when Midland Medical Lodge's first administrative staff member was tested positive. Oh, Whitney, hold on.
Oh.
Okay, you were muted, now go.
Once it became clear that the mitigation efforts that were in place had still allowed for a patient to become positive, that's when we made, or a resident, I'm sorry, to be positive, that's when we made the announcement. When we were speaking with, we've been in contact with their administration staff regularly since the first staff member became positive. They were excluding them from work, and they implemented the full PPE for staff in their facility. So there was low concern for resident cases. So once we realized that a resident did become positive, we wanted to make sure that the public, especially those with loved ones that are in these facilities, were made aware at that time.
And then the next question comes from Mitch with Marfa Public Radio. Are there any other residents at any Midland nursing homes or retirement communities that are exhibiting COVID-19 symptoms, but their test results are still outstanding?
At this time, we just have the 2 nursing facilities that have the positive residents, that are currently exhibiting symptoms, or that are currently positive cases.
Okay, and then this one will be the last.
Symptoms, as far as exhibiting symptoms, we have not been made aware of any nursing facilities outside of the ones that we are currently investigating.
And this will be the last question for Whitney since she has another conference call to get to. It's CBS 7 again. They said, but even with limited concern, given the circumstances, why not let the public know early on to keep them in the loop?
As I stated previously, there was very low risk to the public, considering no visitors, no new patients were allowed to be admitted into these facilities. So once we found out that a resident was positive, we made the announcement more so for their loved ones so that they would be aware that there was spread within the resident population.
All right, thank you, Whitney.
Thank you.
And now we will turn it over to Orlando Riddick. Orlando, I'm trying to unmute you.
Yep. I just had a
Okay.
item come up to say unmute, so I should be good at this point.
You are.
All right, great. Good morning, everyone. I'm Orlando Riddick, Superintendent for Midland ISD, and this is our Thursday, April 16th update. I want to share 2 big components. One's going to be on meals, and the other's going to be on Wi-Fi. And so on meals, I've shared before and previously, and there will be calls that will be going out to our community, that we're going to go to a 1 meal delivery a day, and that's going to begin on Monday the 20th. And so I want everyone to know that we're no longer going to do a 7:30 and an 11:30, so a breakfast and a lunch. We're going to have you pick up both items at the same time. So that will be at 10:30 to 12:30, Monday through Friday. Again, 10:30 to 12:30. It'll be a single meal pickup, or excuse me, a singular time where you can get both breakfast and lunch during that time frame. From 10:30 to 12:30, you'll be able to get breakfast and lunch. And so that'll begin Monday, the 20th. So the locations will remain the same. So we're still delivering our Meals on Wheels program. We're still delivering at the other brick and mortar facilities. Our buses are still pushing out, but they'll be delivering the breakfast and lunch 10:30 to 12:30. So be sure that that's something you note. There'll be a call out coming from your campus principals, identifying that as well. I'm almost certain Monday someone will show up at 7:30, but just know 10:30 to 12:30. Our Meals on Wheels program is still going to continue. Our buses will still push out our meals. One identifier that we have a number of parents who are picking up their meals for their kids or multiple kids, or guardians who are picking up meals for kids that they're watching during this time frame. We are, the Texas Department of Agriculture is requiring us now as part of our auditing piece to have parents who are picking up meals without kids in the vehicle with them or walking up without kids to identify the students that they're getting meals for. So we have a form that we're gonna give you, and you need to identify the students that you're picking up meals for and just give us that form back. That's so when we are audited by the Texas Department of Agriculture, or we do request reimbursement back for meals, we're able to provide that documentation in regards to parents who are picking up meals without kids in tow. So just know as well that on Monday the 20th, we're going to be giving you this form when you do come to our pickup locations and you do not have a student with you. That form is going to be available both in Spanish and Hakachin for our family members in our community, so that they can ensure that when they do come back each time, that we'll have a form, you'll have a form, and just identify the form. So in any of our locations that you do go to, you're able to go through and get the meal and get it quickly. So just know that that's a requirement that we have, that around the state, everyone is having to identify in a way that they're picking up the meal for a student, 18 and under. Next week as well, at our bus locations that we are pushing out food, we have 2 buses that go out into those locations. One is a bus that has Wi-Fi. Those buses will be out there from 8:30 to 12:30. They're they've been boosted to push out much further than just the bus location itself. So just come out early, you know, and take on your work and begin at 8:30 in the morning. And by 10:30, another bus will be pulling up with your breakfast and lunch at that time. So you get an opportunity to get 2 things done during those locations on our bus drive Wi-Fi boosting. We ask that while you're online, there's an opportunity. We have identified locations within the city, identified locations within the district that have buildings that are boosting the Wi-Fi out into the parking lot areas, as well as we've we'll begin a distribution for Wi-Fi devices. But we ask families to go into Skyward Family Access and develop an account if you do not already have one. That allows you to look at every factor about your student, especially their grades. So this gives you an idea of where your student sits today. That way you'll have as we begin the progress monitoring, you know exactly where your student is as we progress through this second semester. We ask that you also go online to complete your online enrollment. It's a very quick process. If you've been in the district, the online enrollment process should not. Census just did mine just here recently within the last several weeks. Ask that you complete that so our city gets all the necessary means and dollars that are allocated federally, that they come to us to support, you know, education, government, hospital, that allow us to do the things that we need to do in our community, that we ask that individuals step out there to get that done while you have the access to the Wi-Fi in a variety of locations throughout our city or all the way into your home. Closing remarks, just want to thank our technology team. They've done a phenomenal job. They pushed a number of factors in a short time period to really draw upon their skill set. That's from deploying Chromebooks and getting Chromebooks ready to be issued and delivered, to implementing Wi-Fi boosting capabilities, which I spoke to just previously, throughout our city and in our locations, to buses that are going out, to allowing the opportunity to bring the teacher from our brick and mortar, from our schools, into your home. This is a dynamic team, and they are certainly making it happen. They've got a hotline that's set up, so parents who are struggling through a number of factors, whether it's I'm trying to connect and I can't, I'm trying to get into the Google Classroom, I'm having a difficulty around these factors, we have a tech team that's there to support you in your need. Not only do you have your teacher, your campus principal, but you have this tech team that's built and designed to support you as you move forward. One thing that we know that that's rests with a number of people, and it was mentioned earlier from Russell Myers, that the governor's going to come either today or tomorrow to present out what next steps could look like for a number of factors. We're looking at it from the school side to see what that might generate from the May 4th executive order for closure. That does closure extend beyond the May 4th timeframe? We'll see what that dictates, and we'll be ready for whatever decision that comes forward at that point. Part of that decision making as well, because we've been ahead of where the governor has been in regards to closure. We're looking to our medical advice from both the cities, both the hospital and health department, to help us understand what decision making do we need to make as we decide to bring 30,000 individuals back into our brick and mortar facilities. And I want to be sure that and ensure you that we're going to make the best decision for our community as that decision making comes forward. We propped up a number of support pieces, not only mental health, information for our class of 2020, our seniors. You're able to go to those locations and draw in some feedback and information to help you gain better decision making for you and your students as we drive forward. But again, two big pieces. Meal times are changing, 10:30 to 12:30. Still, we get our largest portion every day. We're serving about 11,000 meals. 8,000 of those occur during the lunch hour that we have, the 11:30 to 12:30, and about 3,000 happen at the 7:30 to 8:30 timeframe. We're condensing that to one delivery, one time a day, 10:30 to 12:30, both lunch and breakfast you'll get. So you get lunch for that day, breakfast for the next day is how it would work. The other piece is, just know that we have, if you need support, whether it be a device of some type, whether it be a Wi-Fi device, or whether it be a Chromebook, a laptop device, please reach out to your campus teacher, call the campus if you don't have that capability, but reach out to teacher and the campus administration so that we can get you taken care of and ensure that you have what you need in regards to that. With that, I'll take questions.
Okay, the first one is, are you providing PPE for those distributing meals?
Yes, we are. If you drive to any of our meal sites, we've done that early on to ensure that they have protective mask and gloves, and they have all the capability to disinfect and wipe as a prep for the day and end for the day.
And the next question comes from Stuart at the MRT. Can you really envision a scenario that kids should be back on campus in 2 weeks, no matter what the governor states?
I've shared this with a number of community members, and I'll share it here as well, that knowing that after May 4th, there's just a few short weeks to end school, the 22nd. That would be a very difficult scenario to look at based on what's occurring in our community. You heard from Dr. Wilson and Russell Myers and from Whitney Craig around this is what's occurring, and to bring 30,000 individuals back into buildings, that would be I see that as a long shot. Not that it couldn't happen, but I'm hearing from the hospital side, which helped us make our decision making early in regards to closure, that there is still a social distancing aspect of what we can do, and we have control over 30,000 people to make that decision. So I think he may come up with something, but again, we'll make the best decision, whatever that decision is from the governor for our community.
Okay, we'll give them just a few more seconds to see if anyone types anything out or raises their hand. All right. Thank you, Orlando.
And you're welcome. Thank you.
And with that, we will turn it over to Judge Johnson.
Good morning. I'm Terry Johnson, Midland County Judge. I want to take just a minute and thank everybody that is abiding by the advice of the medical community, as well as the president, the governor, and our local officials. It's been said that there are 5 stages of grief, with the last one being acceptance. And I think that we all find ourselves in stage 5. We accept that this thing is real and that we got to deal with it, but we know we're going to come out of it. Slowly, our thinking is that we're seeing a light at the end of the tunnel. However, we should remain cautious in our actions. We can be satisfied that through our modified behaviors, we're winning this battle. I want to take just a second to thank the mayor for all your diligence and your guidance during this crisis. I visited with the mayor. We've agreed, and I visited with our counterparts in Odessa, and we've agreed to bring our crisis team together sooner rather than later to develop a plan on how Midland is going to come out of this. Any plan we develop will be consistent with state, federal declarations. However, Midland must have a Midland-specific unified plan for reopening our schools, our business, and our churches. As soon as we hear from Governor Abbott, as soon as we meet with all of our stakeholders and our plan is developed, we're going to present it to the community. So far, 787 people have joined chat, almost 200 more than just a couple of days ago. Since inception, an average of 5.98 have reported symptoms. This is good information. But what's somewhat troubling is that only 9% of the participants are under the age of 29. We need our young folks to participate too, because this virus knows no age demographic. We're very happy that we've had this level of information, but we need more participation. Remember, by not participating, we're not doing everything we can to slow the spread and get our community back to business. So please opt into chat, all capitals. The details are scrolling at the bottom. And I'm also pleased to announce that we've added a Spanish language version to chat, and it's called Chat ESP. Text chat to our Chat ESP to 432-287-7337. Remember, they're case sensitive. Finally, it's very heartening to see that our health professionals, educators, grocery store personnel, and families in Midland County are doing every day to help us through this. On behalf of Midland County, thank you for what you're doing to get us through all of this. If there's any questions, I'll be glad to answer.
All right, let's just give them 1 second. Judge Johnson, you are good. Thank you. Oh, wait. Stuart has one. 1 second. All right. This one is from CBS 7. They said, when will we have an access map to show the zip codes of where positive patients are?
We're slowly starting to develop that information. I hope next week we can start putting that out with some regularity.
Okay. We'll give 1 second for Stuart to type this. Stuart said, we have had people say that English speakers are getting Spanish instructions.
Yes, we just got that up and going last night. And as of this morning, 4 people had hit the Spanish version. At 10 o'clock, it will be fixed. Part of the problem was it is case sensitive. But at 10 o'clock, those that got the Spanish version will get an announcement to try again. But right now, it should be, if you do the case sensitive, you should be getting in.
Mitch asks, can you tell us how many prisoners are in Midland County's jail? Have any prisoners been isolated because they've exhibited symptoms of COVID-19?
As of this morning's report, I have not been advised that there have been any diagnosed with symptoms.
And can you give the number on how many prisoners are in Midland County Jail?
It was 362 this morning, I believe. Total capacity of 500.
Thank you, Judge Johnson.
Thank you.
At this time, we will turn it over to Mayor Payton. Mayor Payton, you may have, there you go.
There we go. Well, good morning to all. On a bit of levity, an hour into this, I want to congratulate Judge Johnson for his running script at the bottom of his screen. I was waiting for some football scores or hockey scores or something like that. But anyways, the high-tech judge. Thanks for that. Thank you all for your patience. Thank you for everything you continue to do. Want to continue to thank our community for everything that they're doing, with the patience you are displaying, with the really the commitment that you are displaying towards the things we're asking you to do, quite frankly, things you're being told you have to do. And so let me move into where we are right now. As far as the city, we're continuing to try to provide all the services that you're used to seeing. I do want to tell you there are some changes taking place as far as how you can pay your water bill. And if you continue to go to the website and create an account, I know there's been a little bit of confusion where people might have been dropped off and weren't sure that their account was being paid. We're not going to shut you off. We're not going to shut you down. Just continue to work through the City of Midland website and establish a new account for yourself as we continue to try to move things online for you. Going back to what the hospital was talking about, I want to affirm to you that our elected officials, our local elected officials, as well as those who represent us here in Texas, are doing everything that they can do to make sure we get as many resources as we can get. There are a lot of you watching a lot of television, watching a lot of news, hearing a lot of information about different therapies, different treatments, different drug options. And while all of those things are being played out around the nation, it's important to realize, even though this is a little bit negative, that we remain not at the top of the list as far as priorities are concerned nationwide. The reason that is because of how good we're doing and how good we're doing in Midland and Odessa. And so when other places are experimenting with different things and you hear our health professionals tell us they have not been able to get a particular therapy or a particular drug, it is not because of lack of effort. Our medical professionals are doing everything they can do. Our representatives are doing everything they can do to get things here as quick as we can. The reason I tell you that is not for you to get discouraged, but hopefully to encourage you. That's why we have to be very diligent about the things we're doing with social distancing, about the things we're doing in our grocery stores, and so on and so forth. We have to continue to be disciplined in what we do as resources slowly get to us over time. So things that you're seeing in the national media may not get here as fast as they get to the places where this is blowing up, whether that be New Orleans or New York or San Francisco or other places like that. We can continue to be thankful that even though we are seeing numbers increase very slowly, we're not having the spike like they're having in other places. We are awaiting, as you have heard from just about everyone, we're awaiting to hear from the governor, whether that's going to be today or tomorrow. I've had some conversations as early as yesterday trying to figure out when we can hear certain things from the governor, what we might hear from the governor. I, like you, am desperately waiting to see if he will loosen some reins so we can get our economy going again. But let me also affirm to you that in getting our economy back on its feet and getting our economy moving again here in Midland and in the Permian Basin, it's going to be a gradual, slow process. There is really no way that we're going to be able to just open the doors. We are working on a plan, as the judge just talked about. We're working on a plan of how we can bring back our economy and open our economies back up. I'll be on a discussion with all West Texas mayors tomorrow night, talking about how we can, as a region, continue to elevate our economy. But even as we do, we will continue to have to practice the things you have become used to, whether that's social distancing, the good hygiene, the washing of hands, even the wearing of masks. I cannot reiterate enough that we will have to slowly get back to our new normal. It will take time. My biggest concern is that we get some changes in place so we can get our small businesses operating again. We can get our restaurants and our bars opened again. We can get nail salons open again. So we're working towards that. We're waiting to see what the parameters will be from the governor. As soon as we know those things, we will be ready to open the economy up in a slow, to use the word that Dr. Wilson has used, really a slow burn to reopen as well. So with that, I want to just continue to encourage you. I know many people are, to be quite blunt, tired of where we are. It's very difficult, but you're doing the right things. I want to continue to applaud you. Be patient with those who do not think what we're doing applies to them, and continue to do the right thing yourself and to encourage people to do the right thing with all the things you know to do through this this really double whammy we're going through in our economy and with COVID-19. With that, Aaron, that concludes my remarks. I'll take any questions.
All right, we don't have any just yet. Let me see if anyone is typing anything out.
Sure, no worry. Siri just told me she was on it, so
We'll let her answer everything.
I'll let her answer every question.
Okay, we have two. The first one is from Mitch, and he asks, as the Texas Railroad Commission weighs the pros and cons of limiting oil production across the state, do you think restricting the quantity of oil companies' produce will help the Permian Basin's economy?
Well, that's a good question. It is out of my expertise to really answer that question. When you have such a division among the different oil and gas companies, as you saw with the hearing that took place, that is really something I'm just going to have to trust the Railroad Commission and the oil and gas companies come to an understanding of what is best. I can see both sides of the argument, so I'm not trying to punt on an answer. I just have to sit in the middle and assume and hope that they're going to come up with the best answer, because I can hear both sides of the argument, for and against, and I'm just going to have to trust their wisdom to do the right thing for our oil and gas companies.
The next question comes from Danny. He asks, what business would be the first to get the local economy up and running? What business would open first?
Well, our hope is, and this is just my hope, and so it's not really, hey, here's what's going to happen. My hope is that the governor loosens restrictions for all businesses, and then it's going to become a matter of how much businesses are allowed to open. It's probably going to be something in the neighborhood of a magnitude of occupancy load, because we can't just open everything up 100% and be able to practice social distancing. So we're not looking at any one particular industry. I'm looking for the governor to talk about loosening the restrictions on what have been termed non-essential businesses, so we don't have this divide between what we consider essential and non-essential, which has caused so much debate around here as well as around the country. So we're hoping all businesses will be allowed to operate, and then we're going to have to work on what that looks like to have a slow, consistent open so that we can get to a new normal over a period of time.
That's all we have.
All right. Thank you all very much. Have a blessed day. Thanks, Aaron.